Thank you, Jan, and good afternoon, ladies and gentlemen. Welcome to the GHGA lecture series, Advances in Data-Driven Bioscience. As Jan mentioned, my name is Simon. I'm a data steward based at the GHGA Hub at the DKFZ in Heidelberg. Today, I'm delighted to introduce you to Dr. Paola Quattroni from the Health Data Research UK, HDR UK, who will be giving us an overview of their innovation gateway that they have developed to facilitate access to health data for research purposes. The data that HDR UK provides is provided by members of the HDR Alliance, and these are a group of organizations that wish to make data available for research purposes. HDR UK is the National Institute for Health Data Science in the UK. So Paola is currently the interim head of Alliance Strategy Engagement, and through this role, she works to grow and develop the Alliance by bringing in new members and supporting the members that are already part of the Alliance, as well as encouraging best practice use of health data across the UK. Prior to her current role at HDR UK, Paola worked at Cancer Research UK in the Research and Innovation Directorate, where she oversaw the development of data sharing and open science policies for the researchers funded by the charity. This was actually a sort of cross-charity role and also involved working with the amateurs in P&I, such as myself, to think about how we share data. And a lot of this was around encouraging researchers to share the data, but also helping them develop the skills necessary to do so. In addition, Paola holds a PhD in microbiology and has worked extensively in open science publishing. As Jan mentioned, we'll be handing over to Paola in a second, and at the end of the talk, we'll be having a question and answer session. So if you have any questions, obviously put them in the chat, or at the end of the talk, if you raise your hand, and I'll ask you to, or invite you to ask the question directly. So Paola, if I hand over to you now.
So good afternoon again, everyone, and thank you for waiting. First of all, I will skip my introduction because Simon did it beautifully, but basically I'm going to talk to you today about the work that we're doing to support trustworthy access to health data. And obviously I will talk about the Health Data Research Innovation Gateway, but before then I might introduce you to our organization, which I'm not sure you've heard about before. So I will talk about our work and our mission. I will talk about how we are trying to tackle the challenge of uniting health data assets and making them discoverable and accessible. And then I'll talk about the innovation gateway for discovery and access. Finally, I would like to also touch on the work on trusted research environments, which are safe environments for data analytics that is also relevant to this work. And then finally, also looking at how we can demonstrate impact of data use and finally demonstrate public benefit. So I'll talk about it for the next 25 minutes or so, and then very happy to take any questions you may have. So about Health Data Research UK. So this is an organization based in the UK, in particular in London. We are an health data charity, and so an independent legal entity. We are funded by public funders from the UK, different ones, and also government funded in part, and we are not a funder ourselves. We do provide some funding to specific programs, but we don't classify ourselves as a funder. We do work with health data, and we drive health data science, but we're not a data controller ourselves. We do work with data controllers, and they are our primary collaborators, let's say. So we also have some scientific research sites, which are all from across the UK. We have about 86 organizations across 32 locations. And the idea is that we collaborate with them and we drive health data science, but also we work with other organizations that might be outside of that network. And these may be associate research organizations, institute, public health bodies, or data controllers and data custodians. I will talk a lot about data custodians, and just as we intend as a definition, we talk about data custodians when we refer to those organizations that are patient holding data or data holding organization, which means they control the data that they may want to make available for research or for innovation. So this is our mission, and basically our mission is relatively ambitious, I'd say. We want to unite the UK health data assets to enable discoveries that improve people's lives. And in theory, we have a 20-year vision, which is for large-scale data and advanced analytics to benefit every patient interaction, clinical trials, and ultimately enhance public health. And as you see, those logos there, those are some of the funders that have contributed to our work to date. I didn't mention before, but we are relatively a young organization. We are about 4 years old, and we're now going through a review period, which will see us going through a review that will help us get more funding for the next 5 years, let's say. So this is our strategy. And our strategy focuses on 3 integrated areas of activity that you can see here in this bubble. The first one is uniting our data, as I said before. One of the main things that we are trying to work on is really to make sure that all of the data from the UK, from the country, can use for research. And to do so, we are leveraging current infrastructure, but also building new infrastructures and services to enable that. And then we are driving advanced research discoveries through the research sites that I mentioned before, but also through driver programs that we might support. And finally, we're promoting partnerships, because we know that obviously to do all of this type of work, we do need all of the healthcare professionals involved. And when I say that, it would be researchers, it would be data custodians, public health agencies, and the funders as well. So collaborations is very much at the center of all of this work. One thing I would like to mention that you might know the UK is basically formed by 4 different nations, and I'm not from the UK either, but I like to compare the UK to a kind of a small ecosystem that can resemble the international landscape in a way. So what we're trying to achieve is getting all of the different parts of the UK to agree on common goals and to agree on standardized processes. And in a way, we're looking as well at internationally, what's happening internationally, to see how we can then expand what we learn to outside the UK, and really making sure that the standards and the work that we're doing does align with the international landscape as well. So just to say that we have a huge convener role as an organization, which means that so far we have already brought together a very big community of researchers, innovators, technologists, clinicians, and different industries, and they all work together on different aspects of the landscape if you think about using our data. And one of the things that is particularly important to us is really having the public at the core of this work as well. HDA UK has a public advisory board, and the public advisory board has a very important role in providing strategic guidance on all of our work. And as you can imagine, the past 2 years have seen obviously COVID-19 as a big part of our work, and we are and these are just examples of how people from the different groups, patient and public group, have really inputted on the work that we've done, for instance, on COVID-19, but obviously on all of the different areas as well. And just to mention that we also have some values that guide our approach, which are basically transparency, optimism, respect, courage, and humility. And we are building representation and diversity within the health data research community. This is something that we started more recently, and we are particularly looking at funding or like supporting projects that are aiming at improved diversity or improved representations within the healthcare sector. And one example is launching a Black internship programs within some organizations that are part of our partnerships. And in terms of the research data infrastructure and services, which is maybe something that might be of interest to you in particular, we have built what we called a UK-wide fair data infrastructure to accelerate and streamline health data research. And I guess the boxes that are mostly referring to that are these 2, the UK Health Data Research Alliance and the Innovation Gateway. So the alliance and the gateway go hand in hand in a way, and as Simon introduced that before, basically the partnership is driving the development of a technology platform, which is the innovation gateway. And the technology platform is what we are using to drive data discovery and data access. We've done a lot of other work in other areas, for instance, like data quality and standards. So we are trying to drive standards in improving quality of the data set, and we do that through the work of the Alliance as well, which means that we get input from specific experts, and they come into groups, and they come in working groups, and they provide recommendations for improving data quality, so that we look at how data can actually be used for research and innovation. Governance and ethics has been an important piece of our work as well, especially, for instance, when we look at regulation around trust research environments or data access processes as well. And finally, we also have been working on capacity building. This is something that we've done more recently in the UK at least, but I guess even more globally. There is a skill gap when we talk about data science. So we decided to launch a new platform, which is called HDI UK Futures. That is a platform to collect material and resources for training material and resources for researchers to actually upskill and really learn more about using the data, about governance, and all sorts of things around using data. So I also wanted to mention the work of the data research hubs. And again, I cannot avoid talking about COVID. I have to say, obviously, being in the landscape of data, obviously the past 2 years have been very much focused on accelerating access to data for COVID-19 research. And just plugging the work of these research hubs, these are partnerships between industry and academia who came together to provide services for researchers. And one of the services that they provided was data curation. So the idea is that the data that they could provide access to could be highly curated and usable for research. And a lot of those hubs have really provided quite a lot of input on the management of COVID-19, and they have really driven some of the COVID-19 research, as you can see in those examples there. So I'm giving you a little bit of a taste of what we've been doing. But I just wanted to focus a bit more on the challenge that we are trying to tackle. And I think this is a challenge that the UK has, but is a challenge that many other countries have, which is about uniting health data assets in general and making sure that you can do research on it and finally benefit patients. And so, very easy to say, but access to data is the first thing that needs to be done, but it's not easy. So we have heard many times that researchers have difficulties in obtaining access, and this can be a blocker to research productivity. Also, we know that the processes around data access are very different across different organizations, and the researchers are simply sometimes confused. The guidance that is provided is not enough. Sometimes it's not clear what ethics approvals are needed for asking for data, for sensitive data. So there is quite a little bit of confusion there, and the processes can be very bureaucratic. So one of the things that we're really trying to do, and I think HDI UK is trying to do as a whole, but the alliance of partners are also trying to do, is really simplifying and streamlining data access governance and processes. And that could potentially speed up access to data and finally accelerate research. So that is a big challenge that we're trying to tackle. And we have decided we're going to do that through the UK Health Data Research Alliance. So the UK Health Data Research Alliance is a group or independent alliance of research organizations, public health bodies, and healthcare organizations in general, united to establish best practice for driving ethical use of data at scale. And the idea is that those organizations are data custodians. So they are organizations who have data to share. They want to make data available for research and for innovation, and they're committed to streamline their own processes and to improve. They know that things don't work perfectly, and they actually come together with us because they acknowledge that and they want to improve. So the idea of creating this alliance is really creating community, getting the experts together, and drive change in practice and moving towards best practice in particular, but also driving standardized processes and streamlined processes. And here is just just an image to show you the variety of organizations we have in. I'm sure many of those are just logos for you and they might not tell you much, but it's just to say that we have more than 65 organizations at the moment that have joined the Alliance, and they are all different. So you might have public bodies, like those bodies who have medical records, that you might have the correspondence in Germany as well. You may have hospital trusts, and so they may have hospital data and different type of data. You may have medical charities with some registries that they may have, disease-specific registries. We have some universities, and we have biobanks. We have Genomics England in there, and some imaging data organizations. So you have quite a variety of organizations. So you can imagine, not everybody agrees all the time, but they come together to try and achieve an agreement on some of the areas that we're working on. And here, I just wanted to show you the areas that are the Alliance priorities at the moment. And as you see here, as you see there on the left, you see that data utility and data quality is one of the areas that we're working on. The trusted research environments is another area we're working on as well. And when we talk about trusted research environments, we refer to secure analytic environments where researchers can bring analysis and also algorithms to the data and use it as a safe setting. Then we've been working on public and patient involvement quite a lot. We've been working on improving access as one of the primary things that we're doing. And diversity within data is also one of the aspects that we're working on, because we want to ensure consistency and representativeness of routinely collected data across the UK. And one of the other things that all of the Alliance members do is really input and provide help in developing the technology platform, which is the Innovation Gateway for Discovery and Access. And what we are actually building is really driven by the help of the Alliance members. And so what is the Innovation Gateway? So I put there for Discovery and Access, but essentially I should say that the Data Research Innovation Gateway is a platform that enables researchers to find the data, understand the data, drives them to analyze the data, to access the data first, then analyze the data, and then actually demonstrate outputs that was generated from the data used as well. So in theory, we're trying to use the Innovation Gateway to support the full journey of a researcher. So this is what it looks like on the home page. So it's a portal, very simple. It's a portal where researchers can find some resources there. You can find data sets, you can find tools, and tools, for instance, analytical tools that might be listed in there and that might be useful for research. Then you can find also some papers and some courses that are listed there. And that's, again, material that we put there for the researchers to actually browse and see if it could be useful for their research. We also have data uses, which are basically the uses of the data that are listed in the gateway, because we want to demonstrate that the data is also used for research. One of the things that Innovation Gateway is doing for the data custodians is really giving the opportunity to the data custodians to make their data fair. So the custodians listing data sets in the gateway make the data findable and accessible. The interoperability and reusability part is something that we're still working on, but is the intention that we are working on ensuring that we move towards that as well. It is fair to say that in 2 years of development of this platform, we have focused for the major part on the findable and accessible part, I would say. One thing I have to mention that probably I didn't mention is that this is not a repository of data. It's a catalog of data sets, which is listing metadata. And so you would see the information about data sets on it. And the data custodians are still the data controllers. So we don't own any controllership, but the data custodians use the platform, but they have their own mechanisms for providing access to data. What the Innovation Gateway does for researchers and what it does for data holding organizations. So as I said, you as a researcher, you will be able to search for data sets. And that could be done by keywords or by looking at collections. We have some collections of data sets. That means that you can find collections based on a specific topic. Or you can use a core discovery tool, which is an advanced search that enables search population data based on characteristics. Then you can find summary level metadata or technical level metadata if the custodians have provided enough information. And finally, you can inquire access to data or also request access via a formal application form, because the gateway at the moment also provides an end-to-end mechanism for access request. And finally, as a researcher, it's possible also to upload papers or tools or create a collection if you wanted to. This is something that the researchers can do already. You could go and browse. It's all for free. You will be able to see what's listed in there. For data holding organization, as I said, the Innovation Gateway gives an opportunity to make data fair. And also, in particular, it offers data custodians an end-to-end data access management system if they don't have one. And that means that everything in terms of managing access requests can be managed online directly via the gateway. So the controllership and information governance stay with the data custodians, but the platform itself is completely provided by HDA UK in this case. And as I mentioned before, the gateway development and streamlined access management are underpinned by the harmonization of principles and best practice that are driven by the experts within the Alliance and the network that I mentioned before. In terms of what's on the gateway at the moment, we have data sets from all of the 4 nations. Majority at the moment is from England, but we have all of the 4 nations. We have some international data sets that come through via partnership or partnership within the Alliance membership. We're looking at increasing that as well. And obviously, we're very much interested in understanding a little bit more about the data access processes internationally to see how we can also drive standardization and streamlining beyond the UK, really. And then we have all sorts of primary and secondary care data, biobanks, and different disciplines as well. On the right-hand side is what a data set list would look like if you were to scroll down. And here is a data set page where you can see the name of the data set, and then you have an about page, which is a very summary level metadata where you have straightforward information, while you can also download technical details if you wanted to look at the information a little bit more in detail. And that is really to give an idea to the researchers on how useful the data can be and what could be used for. And we also give information about the type of documentation, technical quality, coverage that there might be around the data set. I mentioned before, for discovery, we also have a core discovery tool. And this is a search engine, basically, that helps researchers to actually define the inclusion and exclusion criteria, and really define the requirements that they need in a data set. And what the search does is basically looking through all of the data sets that are on the core discovery, and the researcher will receive a result which is a result of all of the data sets that match the requirements that he has. And this is run across data sets from the different locations that we have. It's an advanced search that is not used by all of the data custodians in the gateway, but only 10 at the moment, but we're moving towards increasing the numbers. And just to focus a little bit on access and to tell you a little bit more the work that we've been doing. So you might know that there are a lot of steps to actually request access to data, and you go from an informal inquiry to a data access application, data access committee review, and then legal requirements, legal document before you actually get granted access to data. So all of that process is a very complex process. And what we're trying to do with the Innovation Gateway is really support the researcher at each step. And what we've done with the data access request within the gateway is really to standardize the questions as much as possible so that the researchers find it easier to ask for data from multiple custodians. We also provide a guidance throughout the access request form so that the researchers can really know what to expect. And one of the things that we have done as well with the development of the data access form is following the 5 SAFE framework, which is a framework that, for those who are not familiar with it, is a framework to ensure that all of the safety and the trustworthiness of the data use is considered in a data access application form. So, for instance, we look at safe people. That means we look at how to approve researchers. Safe projects, we look at how the project will deliver public benefit. Safe settings, we look at how the settings is a trusted research environment, what's safe enough. Safe data, so de-identification is going to be important, and safe output, that the analysis of the output is done so that there is no possibility of re-identification. And at this point, yes, also the guidance for researchers. What I wanted to mention, all of the work that we're doing is in line with national policies. So we are trying to obviously have a look outside and making sure that whatever we are doing is in line with what is the national expectations as well from a policy point of view. And for instance, it is about standardizing evaluation of public benefit, and we are embedding that as part of the gateway as well. So just a little bit on the trusted research environments, which I thought might be of interest as well, and would be interesting to explore how this is done also outside the UK. So what is a trusted research environment? So we refer to TRE, or trusted research environment, a kind of what we used to call a data safe haven, which is a highly secure computing environment that provides remote access to health data for researchers, so that they can use a safe environment to provide, to analyze the data and then do their research. The idea is that we're moving a little bit towards a model of the researchers accessing an environment rather than the researcher receiving a data extract. And that because we think that there is going to be an evaluation of the 5 safe framework again at the TRE level as well, we think is a much more secure way of analyzing the data compared to having to do a lot of other checks on the environment that you're using, etc. And if you can imagine that can be standardized across various trust research environments, that might make it easier for actually going through an approval accreditation phase one time and then be accredited for access to different TREs, for instance. This is a very much a work in progress, and we are trying to see how with the gateway we can drive towards this behavior, and we can drive organizations to use trusted research environments rather than data extracts. And again, just to say that that there are many TREs, and again, just please ignore the names because probably you don't know the name of the different TREs that we have in the UK, but it's just to say that there are many research environments in a country. The UK is just an example here. And you can imagine there might be some local trust research environments as well. There might be some commercial trust research environments as well. And if we look outside, international TREs might be there too. So basically, we're talking about environments that are already there. How can we make sure that there is interoperability across the environments so that we can use analytics across those as well? And so just to say that we've been doing some policy work around it to kind of set the requirements for trusted research environments. And we've been doing that work with the National Health Service in the UK. And this is what we are kind of envisaging that can be created. We could drive a kind of a federated, open and resilient ecosystem of secure trusted research environments. And this with the help of the Innovation Gateway at the beginning, when we have a federated metadata catalog that may be driving identity federation, analytics federation, metadata federation, infrastructure federation. So just high level to give you a think of what we've been trying to think towards, but we are not there yet, absolutely. And this is just to say that we're working with the community to see how we can achieve that. And definitely the international component is going to be particularly important. And before ending, I think I wanted to also close on talking about data use and demonstrating data use and outputs. So for us, improving transparency in data use is going to be particularly important because ultimately we are driving accessibility of data, because ultimately we want researchers to do research and benefit patients. And so it is obvious that we want to tell the public and the researchers how data is ultimately used and what are the outputs coming out of it. So we've been working on a data use register, which is a list of approved projects or a public record of how data is used and for what purpose. And we think it's particularly important that all of the custodians who are listing data and making data available, they also make available how the data is being used and what's being produced from that data use. And we're doing that, so we have produced a standard with the help of the Alliance member, and we have published a paper on that one. But we're also implementing a data use register in the Innovation Gateway. And the idea is that the data sets that are listed in the gateway then are used, and we can link data sets to the data used directly, and the data used to the outputs of the data of the research that is being done. And we have that already available in the gateway. It's only a minimum viable product for this one, but we have more than 600 data uses already listed in the gateway at the moment. And I think last slide, just to summarize basically how the Innovation Gateway is supporting the entire journey, the user journey or researcher journey in a way, from data discovery to impact. And it's fair to say that we've spent a lot of effort on the discovery part and access part, because we have implemented a lot on the search and the core discovery and the data access management. But we're now working on the TRE federation, and we're working on the policy. Quite a lot of work that needs to be done, but we're looking at analysis as well. And finally, we're looking at output sharing for reuse. With the data use registers, what we want to do is linking data sets to data outputs as well, making sure that this is really well explained and is as transparent as possible. So I'm going to stop here. I probably talked too much, but happy to take any questions if you have any.